overlooked one member of the subcommittee, so at this time yields 5 minutes to Mr. Griffith from Virginia.
Thank you very much, Mr. Chairman, and I apologize to both you, Mr. Chairman, and to our panelists. I have been involved in another hearing as well, and so I have been running up and down the stairs trying to make sure I got here. I want to agree with Representative Tonko in saying that putting this law forward by Dr. Murphy is a big step. Somebody has to put it forward. We've been studying it for a little while. He decided to take that leap, and I commend him for that because that's very, very important. There are things in a bipartisan fashion that we can work on to improve the bill. That being said, and I heard Dr. Murphy say earlier he's looking for those suggestions. That being said, I also want to underscore that HIPAA does have to be addressed. Now, it doesn't mean we want to undo the principles of HIPAA. It doesn't mean we want to, let everybody have access. But we heard so much testimony from so many family members who wanted to help, people who loved the individual with mental health problems, who wanted to be there for them. And in many cases were not able to be there to take care of them because they were blocked. They were blocked from having the necessary knowledge to know whether or not they were a risk to themselves or to others. They were blocked because they didn't know exactly what was going on. So we have to improve that. Where I would like to see improvements in this bill is in figuring out how to define that. Because when you look at Section 301, we have a real opportunity to work on that across the board, all parties coming together, and figure out how we do that. My concerns particularly relate to two groups of individuals. You've got the elderly. It's pretty obvious that with an elderly person, if you have competing children, I used to do divorce work in my small town private practice. I did a lot of criminal work. People will fight over all kinds of things, and particularly when it becomes mom or dad, family members get into a fight. So we have to figure out a system where if you've got a child who hasn't been involved in mom's life for 20 years, that they don't come waltzing in and knock Ms. Thompson out because all family members get it. We also, I worry about in that same situation, the young man. We've heard so much testimony that young men, particularly in that suspect group, 14 to 18 is a problem, but 14 to I think was 28, Dr. Murphy can correct me on my ages, where there's a lot of onset of first signs of mental illness and they don't get treatment. 14 to 18, parents are still involved. Right. On that 18th birthday, they get knocked out. And whether that's what HIPAA is supposed to do or not, it's the way it's interpreted. And if you're worried about a lawyer suing you for giving away the information, you're not going to do it as a doctor, no matter what different people may think it means. Dr. Murphy's right. We've got to clarify it. But then I also worry if you have too big a door for people to get information, does that estranged father come back in, never having participated in his son's life, and now the son is 22 and he decides he wants to come in and knock mom out. So that's the scenario that I'm looking at. I think we can make improvements. And with that, Mr. Chairman, I yield to Dr. Murphy.
I thank the gentleman. I also thank you for your commitment to help us improve that language. It's important. We've had too many people raise concerns. We have to do it the right way. Dr. Shern, you had mentioned that you're aware, let me ask you,